Now we have 2 minutes to talk before starting the presentation. Do you have any idea about the process of these meetings? You can share right now. That's a good opportunity for us to hear from you. We tried a lot to reach out to you about your challenges with working on worksheets or the things. How is our cohort? Let me know, one of you, please. We need a volunteer. Are you hearing me? Or I'm mute? No, I'm not mute. Okay, I should break the ice. Hello, Dr. Badar.
Hi, Marzban, how are you?
Good to meet you. Hello, Marzban. Hello, Catherine. Hello, Amin. Hello, Ahad.
Hello.
Good to meet you again. Good to hear from you again.
Hello, everyone.
Hello.
Hi.
Good afternoon. Good afternoon, Dr. Hen.
Hello, everyone.
Good afternoon, Dr. Ahmad.
I'm from surgery.
Okay, great. Great to meet you.
Great to meet you too, Doctor.
Hi, Dr. Meher. My pronunciation is good. Dr. Meher Brahma.
Yeah, hey, nice to meet you guys. I'm just
Nice to
covering
meet
for
you.
Umberto for this week, so I'm not really familiar, I guess, with the whole process. yet.
Okay. Thank you for joining us. So let me start my presentation to value your time. Let me share my desktop first of all. Can you see?
Yes.
Okay,
Yes, we
great.
can see.
Good afternoon, everyone, and we are so glad to start our third module. We are happy that we see new faces among you, new names, and we are very glad to work with the liaisons who continuously are working with us. We are very excited that we received a lot of projects and ideas. During last month, we received a lot of ideas from residents and fellows, and I don't know, is it the impact of this cohort or your conversation with your colleagues and peers or in your departments? We don't know, but we are really excited and thankful to this conversation and dialogue and starting new ideas and turning the new ideas into research. Laura and Dr. Shuruti, Dr. Ricardo, our research fellows know that how the amount and number of projects are rising in our department. So we are very glad to help everyone that comes with a new idea. And that's our task and responsibility to assist you. But it's a mutual thing. It's a two-way communication. We need your feedback as well, how we can improve this. And we would like to hear your ideas and comments and suggestions. We know that it takes your time, a part of your time to contribute to this cohort and this training lab. But you should know that research is a time-consuming skill and process. So you should spend and invest your time in it if you want to take advantage of the research skills and competencies later in your career promotion. The other point is all of you are responsible to provide a project and a publication or a scholarly activity for your graduation. So it's a requirement of the graduation. It's better to do it and manage it now with us, with our help and assistance, with these, people who want to help you, assist you, guide and navigate, and with the guests who are coming from other institutions like Dr. Shilpa, that we will invite her for her presentation. She's coming from Johns Hopkins. We will invite other people from other universities to add their value and knowledge and competency to this training cohort. So it's a great opportunity. It's a golden opportunity to value this cohort and this collaboration. And if you value it and take your time and value this, mutual way of collaboration, it would be great for your graduation purposes as well. At the same time, it impacts your career promotion in the future. So these are our proposals, and I think it helps you to graduate on time with a navigated effort and program and research project. So let us start this presentation by recognition of where we stand now in our cohort. The first module was identifying research issue and topic. The second one was research issue statement. We talked a lot about how to state our research topic and issue. And this is the third module about finding reliable publications and resources to state the issue. And a part of the third module is defining the research question. Let us know how we can define the research question. We have received a lot of ideas about research topic, a lot of ideas about systematic review around a topic and around an issue, or clinical trial, or quality improvement. So you developed your topics. Now we want to develop a relevant research question. What is our question? A specified question of our research. Second of all, we want to find the evidence and appraise it critically. It's important that we should find the relevant evidence and then gather and appraise the relevant documents as the best available evidence for our topic. So critical appraisal is important, and it's a part of the process. It's not only search of the databases. After the search, we should be able and competent how to analyze it and how to appraise the available evidence. So after that, Dr. Shilpa will help us and will explain us what are the scientific ways of database searches, how we can search and define the queries among the known databases for the clinical literature. This is our learning objectives today. First of all, developing a research question. We talked about title and the issue statement that should include why and what. In the research question, we address the part of the title of the project, and we will include why and the what in a very summarized and brief definition and a statement of the research. So in your question, the goal should be reflected. The goal of the research should be reflected. The goal of data collection should be clear. A focused research question leads to a systematic planning of a research project. So role of research question definition is very important because it's the main part of your research structure to define a relevant, a proper, and a meaningful question for your research. And if you define a well-developed research question, it will lead to appropriate study design and method. So in your definition of the research question, you are addressing what is your research design and what's the methodology of your program, of your research project. So, for example, when you define a research question about a project that addresses association of women's adverse pregnancy outcomes and pre-pregnancy issues relevant to fertility. That's the topic of the research. You can see it's included here in the research question. So it's important to address the research title or a rewording of the research title in your research question statement. But you should address what is the aim of this study. The aim of the study is to conduct an umbrella review, which is a type of review of evidence of systematic reviews evaluating association between those. So with this statement, you are defining what's the aim of my study, you know? And then you should address what is known and not known, and then to propose recommendations for practice and research. So this is the aim of a study. You included the title of a study. You included what would be measured within that. And the research question is what is known and not known. So here, the reader of your article, of your project will know that you don't measure anything in this study, you know. You don't compare a control group and a case group, intervention group. You are just trying and develop the plan to know more about the facts around this association. So you're reviewing the evidence. Here you are addressing that my research methodology is review of the evidence. So there is no comparison. There is no measurement for association, for contributing factors, for causality or anything else. This is not experimental. This is not interventional. This is only a descriptive review of evidence without any intervention, you know? So you are addressing the study design and methodology. If you can define your research question well, your method goes well. It's important to start your project with a good question. We will talk about these research methodologies later. Now, just I provide some hints to it, a summary of that. And then in the module 4, we will address everything about the methods. Just as hints, keep in mind that we have observational studies, experimental studies, review of evidence, and quality improvement for now for this cohort. You know, there are many different classification of research methodologies. If you search through available evidence and online literature, you can find many different methodology, classification, and categorization. But these are the things that we are working in this training lab for you as the people who have joined us for your, you know, the first experiment, the first experience with the research. So it's important to know that the research can be just observational, not experimental. Those are verses together. What does it mean observational? It means you want to describe the data on one or more group of people or individuals without any intervention. So case reports are a type of clinical observational studies. Case series are also just observational because you are describing the data. Cross-sectional studies are retrospective studies that describe the data and facts. They don't have any intervention or experiment on the patients. Ecological studies are the same. They are trying to explain how exposure factors affect and influence some results, you know, just as a description. There are clinical observational studies that step one level behind. So they go to analysis to test a hypothesis or establish causal relationship between different variables. So when you describe and analyze two factors, how they are correlate and associate, that's a clinical observational in an analytical manner. You know, analytical studies test a hypothesis. So maybe they are not interventional and experimental, but they can be experimental as well. So just you should change the lens on how to categorize these. There are, as I told, there are many different classifications. Just have it for your start. But clinical experimental studies have an intervention or experiment in their nature. They want to examine or test new solutions or a combination of the new solutions or a standard practices compared to the other comparator. Review of evidence is the other part or other class of studies, and quality improvement, that's the other point and other goal of research studies right now in hospitals and in medical literature. So you cannot find the quality improvement in the in traditional classification of the disease of the research methodologies. This is one of the, you know, classification illustration that I found in my search. You can find many other images, but you see here, descriptive ones are case reports, case series, cross-sectional, analytical can be observational or experimental. The observational one can be cross-sectional, case control, and cohort studies. Cohort studies are prospective. You cannot see here evidence of evidence review, systematic reviews, or any other type of reviews. And you cannot see here quality improvement because those ideas should be added to the traditional ways of categorization of the research methodologies. Maybe a time this team can publish the results of this cohort in a new version of this classification. So I just introduced you different type of methods that will be discussed in detail. We will discuss everything in detail in the next module. So that's an opportunity for you to learn about that. But for now that you want to develop your research question, it's important to know the research question is defined for which type of research methodology. If the research method is a clinical intervention, you can develop a PICO-based or oriented question. If your research method is a review of evidence, a systematic review, and a scoping review, so you can develop this question as well. But for quality improvement, you cannot use this pattern. For quality improvement, you cannot use this pattern. You know, just keep it in your mind that for quality improvement, you should use another pattern, another criteria for developing your research question. Have it in your mind that you should define who are the population of interest in your research, what would be the intervention, what are the control group, and what would be the outcome. So you have it as a reference for your work. Let us talk and discuss our examples. Please read this example. In this example, you can see that population of interest for the research, for this research, are children with acute otitis media. The intervention is cefuroxime intervention. The comparator is amoxicillin. So you want to compare these two, and the outcome is reducing the duration of the symptoms. So in your research question, you should have all of these. You should include all of these factors. If you are reviewing evidence for this question, you should include all of these. If you're reviewing 2 comparators, 2 antibiotics, 2 medication, 2 solution or treatment, you should include all of these in your research question. Example 2. Here, you don't have a comparator. You cannot see a comparator. What is the comparator? It's a standard of care, the routine practice or no practice. So when you assess or evaluate the effectiveness of an antibiotic or a medication or a solution, an advanced care with nothing else, it means that you are assessing the effectiveness versus the standard care or routine care or no practices. You know, this is another method for defining the research question. There are other criteria to assess and evaluate your research question. You can review it later. And keep in mind that usually there are some linear relationship between cause and results, but there are many other type of relationships that are circular. You know, those are not linear approach. That's systems thinking and how different factors affect your phenomena, your disease condition, or the main idea, main issue of the research. Those are not linear causal and result causality chain or influencing a factor by other factor as a linear impact. So we should know more about how different factors in different layers can affect the main idea, that is a problematic condition for patient groups. Okay, I want just to introduce this model in 5 minutes, and then I will leave the stage and hand over everything to Dr. Shilpa. This is a model on how to collect the best available evidence based on your defined question, okay? When you define the question, you will locate the evidence, evaluate the evidence, assemble the evidence, and inform the decisions if you want to collect data for a better situation, for changing something in your practice, for having a change in your context, in your daily practices. Let me explain more. You see here, we have systems perspective and opportunities to generate evidence for informing decisions. So from this model, you can find that this model is more meaningful about quality improvement. You see, that's a model that works better and works essentially and fundamentally for finding new solutions and changes in your practice workflow to impact a change, to impact something, bettering and improving something in your daily practices, in your clinical practice, work environment, or organizational efforts. How it is, when you talk about locating the evidence, you want to know how specified questions have been addressed in the available evidence, and what evidence can help you to have insightful approach and comprehensive science, comprehensive recognition and knowledge of the situation. So finding relevant evidence with the targeted population, with the relevant context. For example, if you are talking about the children, we should find something in the similar context relevant to children. So it helps us to locate our evidence based on our specified question, research question. It's not enough to collect the data, to locate the evidence in a similar situation with the similar context or similar population. It's important to evaluate the evidence. So quantity of evidence is important, quality is important, and the skill and art of minimizing the volume of the evidence is important. And how you exclude the imperfect and incomplete evidence, how you exclude the evidence that doesn't help you and it's not reliable and credible and qualified for your research. It's another art. It's the higher level of your skill set to exclude those. So how to use the existing tools like the checklist, Prisma checklist, economic evaluation checklist, other checklists that assess the quality of the evidence is important. You should locate evidence, evaluate evidence, and then assemble evidence again for your purposes. It's important how to assemble the selective collection of the evidence that are relevant and valuable for your purposes. And the last one is use those selected evidence for your purposes that are bettering the situation and informing the decisions. For quality improvement, you should use the evidence for informing your decisions and your solutions for quality improvement, for bettering the situation. That's a summary of how you can define the research question and how you can use the evidence for your purposes. Now the stage is yours, Dr. Shilpa. Can you please introduce yourself first and then let us know how we should search the databases, the known databases?
Sure. Thanks a lot, Dr. Sima, for giving me this opportunity. Hi, everyone. Hope I'm loud enough. My name is Shilpa. I'm a postdoctoral fellow at the Johns Hopkins School of Medicine. I'm in the transplant oncology infectious disease department. So we mainly work on a lot of COVID research. And I'm also a trained dermatologist from India and UK. So my interest is also in skin cancer research. And we're also collaborating with the Larkin Hospital and especially with a few of the research team members. And we are working on several different papers. So today I will be demonstrating how to search databases, and I will just share my screen. Can everyone see my screen?
Yes, doctor.
Okay.
Yes.
All right. First, I'm sorry, I don't know which screen. Let me just share it again. Sorry. Okay. So first of all, I'll be talking about Pubmed and then the EMBASE as well as the Web of Science. So Pubmed is produced by the National Library of Medicine. It provides free access to Medline, which is the National Library of Medicine's database that provides citations and abstracts from around the world. So a lot of people are confused with the terms Pubmed as well as Medline. They don't know the difference. Pubmed is actually a tool that allows the Medline database to be searchable. However, the Medline database, it can also be searched through numerous other search services, such as the Ovid, EBSCO, and Elsevier, but these license the data, so it's not free. But with Pubmed, we can actually search the Medline database for free. So to begin with, I suggest everyone to create an account in Pubmed, as this would save all your searches. So I already created an account for me. In Pubmed, initially, I'll be talking mainly about 4 main concepts. First is the Boolean operators. Next would be the nesting to group the similar terms. Then is truncation, and then quotations. So let's take an example for our search. There have been several articles published on the possible risk of cell phones causing cancer in children. So this was actually several years back. And let's say we want to know how the literature has recently changed. We can start by doing a simple PubMed search by typing in the key terms in the search box. Okay, so I would be typing cancer, children, and cell phones, and clicking on the search button. You can see that there are about 233 results. To know exactly what PubMed did to find these results, we can click on the advanced link here and scroll down to the history and search details box. And by clicking on the arrow under details, you can see what PubMed actually did to come up with these results. So there seems to be a lot going on here that we can discuss. So first, I would like you to take a look at what is the AND, as well as the AND terms here, as well as the OR terms here. And the AND, OR, and NOT, these are what are known as the Boolean operators. So what happens when we use AND in between the words is we are basically telling the database that we want to include all the terms. So anything which is before as well as after AND will be included. Each time AND is added in between the words, the results actually get smaller. This is because the articles need to include both the terms or all the terms to show up in the results. And in this case, so we can actually go back and see what happens when we add AND. So you can see cancer, children, and cell phones. So we are getting again 233 results. This is because by default, PubMed always adds AND in between the words. Okay, the next Boolean operator here is the OR word. So OR is when we combine the words using OR, basically you're telling the database to search for any of these topics. Okay, so each time OR is added in between the terms, the results actually get bigger. And OR is also most often used with synonyms or similar terms in order to expand a search. Not, the third Boolean operator would be not. Not actually tells the database to eliminate articles from the search that uses a specific term. Okay, so let's say that you type in cancer, not leukemia. So then you will be getting all the results, which is cancer, but not leukemia. But however, I suggest being very cautious while using not, because it may remove relevant citations too. And also one tip while using the Boolean operators is it's always best to use all caps. They also work in lowercase, but this is only a recent improvement, so it would always be best to use caps for this. The next concept is what is known as nesting. Nesting is when we use parentheses to group the OR terms. So especially when, like, let's say in a search like this, you have both OR as well as AND. That's when you use nesting. I'll just explain more in the next section. For now, you just have to know that nesting actually means using parentheses, and actually most of the time Pubmed would just automatically put the parentheses. Okay. Next we have quotations. So quotations work best when phrases are used. So one thing to keep in mind is that Pubmed, like I mentioned, it automatically adds an and in between the terms. So this can actually cause problems when phrases are used because you get a lot of off-topic results. So for example, you want to search for just skin cell, and let's say that you are searching for skin cell here. Okay, so you're getting about what, say 280,000 results. That's because all the articles which have both the word skin as well as cell as being pulled up by Pubmed, and you're just looking for skin cell. So in this case, to remedy this, it would be best to use double quotations. So double quotations are very specific for Pubmed. If you put a single quotation, it's not going to work. So you can use double quotations and then search again, and then you get around 1,000 results. So it's not necessary to use quotes around single words. They're best used around multi-word phrases. And then another concept I would like to talk about is what is known as truncation. So to save time, Pubmed allows using variation of a root term using the asterisk symbol to represent the rest of the term. And using that asterisk symbol is what is known as truncation. So for example, using asterisk at the end of the word child. So I type in child and then I do the truncation and I search. Then you can find variations of this root term. So that would be child, and then you have children, and then childcare. So Pubmed basically pulls up anything with all the variants of child. So this is actually very helpful because we don't have to think of all possible variations of a term because Pubmed is automatically doing it. Also, one important thing to note here is that Pubmed always adds truncation, always recognizes truncation, which is there at the end of a term. Okay, so let's say that you want to search for cell phone, or cell phone tower. Okay, so let's say if you type in cell and then use the truncation and type in towers, you're not going to get it because Pubmed just doesn't recognize it. So in this case, what you should be doing is again using the quotations. And then the cell tower would be, the truncation would be at the end of the phrase, and then again close the quotation, and then you can add an or term and search for this. So this is how it will be done. So then you will get the most relevant results. Also, you can note that the quotations as well as truncation can be used at the same time in Pubmed. So understanding these four concepts, which is the Boolean operators, the nesting, truncation and quotes is very important to build an effective as well as an efficient Pubmed search. Okay, so the next section, I would like to talk about how to build an effective search. So building an effective search includes, one is developing a research question, and also conducting a preliminary search, and also identifying the relevant search terms. So depending on your goals and projects, there are many different approaches to do this. And I'll just demonstrate a very systematic approach that can be used in Pubmed as well as in other databases. So the first thing you would be doing here is basically you would be finding what is known as medical subject headings or mesh terms and keywords. Then incorporating the Boolean operators and the truncation and field tags, and then you can run the search. Okay, so first to build a search strategy, it would be helpful to document everything in Word. So like this is actually a paper we are doing with the Larkin team. So in this, we are actually trying to look at the variants, the COVID variants, and also the breakthrough infections. So what you would be doing is any topic you pick, it's always best to break down the concept. So it could be 3 or 4 concepts. So our first concept here, for example, is the SARS-CoV-2 variants. And as you can see, we have added or in between each of these terms because they're almost, we are looking at either one of them. Concept 2 is where we are looking at only the variants. Concept 3 is the breakthrough infections, and then we combine all of them using and in between the concepts. Okay, so the first step would be to identify the mesh terms. So mesh is like MESH, mesh term. That actually refers to specialized subject headings, medical subject headings or controlled vocabulary, which is used in Medline. So all the articles which are in the Medline database, they are actually indexed with this vocabulary. So there's actually someone who sits there and does that. Okay, so mesh terms are really valuable because authors don't have to use many different terms to search for one concept. So what happens is that, say for example, you want to search for hand washing. Okay, so authors may search for either hand washing or sanitizing or hand scrubbing or surgical scrubbing. So there are so many different ways of searching. So you may actually miss several key articles. So mesh term actually becomes very useful in this case. So there are actually two ways to search for the mesh terms. One is you just go to the article. So let's say I'm searching for hand washing. And then you just go to the article. And then you can scroll down. So you scroll all the way down and you can see the mesh terms are here. So that's beneath every article. So just clicking on say hand disinfection or methods, and then you can just search it in the mesh database. The other way is to just come to this mesh database, which you can either do through a simple Google search, or you can just search for Pubmed and then say that you just want to search with mesh. So this is actually the mesh database. So the terms here, as you can see, are arranged hierarchically and by subject categories, with also the more specific terms arranged beneath the broader terms. Mesh term in Pubmed automatically includes the more specific terms in a search. Okay, so let's say you're searching for hand hygiene, it will also automatically include hand disinfection. So all the narrower terms are also included. And this is what is known as explode. So explode means it will search with all narrower headings beneath the main heading you have chosen. But if you want to turn this feature off, then you can either click on this, which is restrict to mesh major topic, or you can say do not include mesh terms found below this term in the mesh hierarchy. Okay, so if you want to say search only for hand hygiene and you don't want hand disinfection, then you can click on this. And also below the term here would be the definition. And so if everything looks good, then you can click on add to search builder and then search the Pubmed. Okay, so that's how you get the mesh term. So then you can click on advanced and then you can see that, okay, another thing I want to talk about is all your searches are actually saved here. So if you create an account, it'll all be here. Okay, and also once you find the mesh terms, the next thing would be to find the keywords. So the reason is because you can't just stick with the mesh terms and you also have to go for keywords. This is because there may not be a mesh concept. Like here you have hand disinfection, which is a mesh word, but you may not have that for every word. That's because a lot of newer articles are not yet indexed. And also if you use some of the newer mesh will not capture the older articles. So you need what is known as keywords. Okay, so keyword, for example, this would be a keyword. Like I'm saying breakthrough infection, another keyword would be reinfection. So maybe you may not find this in the mesh database. So you'll have to come up with it on your own. So how to generate a keyword is one is to just go to the Pubmed database and you can just go to the mesh database or the Pubmed, and then you can look at also other keywords. So in this paper, for example, that's what I did. I went to the mesh database, I looked for COVID variants and I found all these different terms. Another way is to just by looking at the articles, just reading a few articles will kind of give you an idea. Or you can also look at another database, which I'll be demonstrating shortly in EMBASE. It's what is known as M3, and you can actually find additional keywords. So keywords are nothing like synonyms or like other words which sound the same. So those would be the keywords. Okay, so once this is done, you find the mesh words and then you find the keywords and then you go to the advanced. So that's where you'll be entering everything here. So once you enter, say, for example, you're entering arsenic, okay. Or I can just do the same example, but that's just a little more complicated. So then what you would do here is you would use field tags. Okay, so field tags, these are what are known as field tags. Pubmed automatically searches for all fields, but you actually don't use all fields. This is because all fields means it searches for the title, the author name, author affiliation, journal name, abstract, language, I think even the mesh, the author supplied keywords. So this is a very thorough way to search, but it'll lead to a lot of off-topic results and you don't need that. So for systematic reviews, what we usually do is we use the most commonly used field tags are the title and abstract. Okay, I would just stick with that. You can also use text word, but text word also makes it more exhaustive. Again, what you see here is, sorry, the text word. So text word would include the title, abstract, and also the author supplied keywords, but it does not include author affiliation, author last name, or journal name. Okay, so I would just suggest everyone to just stick to title or abstract. If you think that your topic is like very rare and you want to include everything, then just include text word, but all fields would just give a lot of off-topic results. And what you see here is title. So title is sometimes used when you just want to scope the literature, like you're just trying to find what articles have been published. So if you say title, it will only pick up this term arsenic, for example, and only the title. Okay, and this is pretty much easy. So once you do this, you can say add, and it'll come here. So if you choose text word, then there'll be a text word here. So either you can add with and, or you can say add with or, and not, as I said, it's best to avoid this. So once everything is done, then you can search it. Okay, so that would be the search. And once there are different searches over here, then you will be, I think it's here. Yeah, the different searches over here. So you can actually add this back, for example. Sorry, I'll just do a different one. If you say add query, and then the next one can be either added with and or. Okay, so that's how you actually combine all these concepts. So the last thing I want to talk about today is what is known as automatic term mapping. So going back to our hand washing example, so if you search for hand washing and then you click on advanced, so for example, you click on advanced. So what you can see over here is this thing, what PubMed has done is what is known as automatic term mapping. Okay, so that means PubMed automatically takes every concept which is entered in the search box and it searches it against PubMed's many indexes. However, if you use like a quote, like you're using a quotation over here, then it will not, the automatic term mapping is automatically turned off. Okay, so yeah, I think I pretty much covered everything. So that concludes the PubMed search. I would next like to talk about EMBASE searching and as well as the Web of Science. So EMBASE is, sorry, let me just. Is everyone still able to see my screen?
Yes.
Okay.
Yes, we do.
Okay. So this is the EMBASE database. You need to create an account. Either I think you need to have institute access, or you can also create with your Gmail, I think. But because I have a Gmail account, but right now I'm just browsing it anonymously. So again, it would be best to create an account because every time you create an account, you can always save it. So in EMBASE, the quick search which you see over here, this is the default search. So similar to PubMed, again, you need to you start with using controlled vocabulary as well as keyword terms. Okay. So the controlled vocabulary, just like how you have mesh in PubMed, the controlled vocabulary here is what is known as M3. So actually M3 is also very helpful in different ways. Like I said, when you want to find keywords, then M3 is best because let's say, for example, you're searching for arsenic. Sorry, I don't know where it went. I'm sorry, I think I have to log in again. Okay, let me try this. Okay, so if you search for arsenic, so M3, what it does is it actually gives the synonym words for arsenic in it, arsenic or any other word you enter. So that's why I like M3 because it's very easy to find keywords. So if you type in arsenic and then you select find term, then you can select the M3 term over here, and then you can see this is basically the same thing, the hierarchy which was there in the mesh database. So again, so then you add to query builder. Okay, so what you see over here, EXP, this actually means explode. So explode means that anything which is found below this is also being included. Okay, so any narrow term would be included. But if you want only arsenic and you don't want anything below that, then you can say you just want it as major focus. And then you again add to query builder. So again, the keywords can be, so these can be either single word or multi-word phrases. And again, as you can see, there are quotations. And in case of EMBASE, you're only using a single quotation and not double. Even if you use double, it'll automatically convert it into single, so you don't have to worry about that. Okay, and the truncation that is with using the asterisk symbol, that is similar to Pubmed. Next, what you do is you click on Take to Advanced Search. Okay, and then you can see all these different options you have. So the mapping option is sometimes already filled out. This is the EMBASE mapping option. If it's not, then you can search all the first 4 options. I usually don't say limit to terms only as major focus, because especially for systematic reviews, you do want a sufficient amount of results. Okay, and then you can enter the date and the sources usually. So actually EMBASE, what it does is it looks at all the other databases, including Medline. So especially when you're doing systematic review, you get a lot of duplicates when you're combining Pubmed as well as the EMBASE searches. And then coming to the field. So the field is similar to the field tags I just explained in Pubmed. So for systematic review, it's best to use, again, article title as well as abstract. You can add, this is pretty much what I use. I don't usually like to put anything else because it just makes it like you get like 6,000-7,000 results, you won't be able to go through it. And drug trade name is usually whenever you use drug, but pretty much just sticking to these 2 is enough. And then you can run the search. Also, one important point to remember is also you have to always limit the keywords or the terms you use. So let's say, for example, I'm using SARS-CoV-2 variants, and then I'm using all these words in concept 2 and concept 3. So it's always best to use these same words in every database you search. Okay, so whether it's Pubmed, EMBASE, Web of Science, Scopus, and if you're adding more here, then it's always best to use that also in the other databases, because you want your search to be similar and you want to get like same number of articles. Also, the next thing is in parenthesis, and also the other one is, I think the truncation is similar to that of Pubmed. So it's pretty much the same, except for these 2 things. And also the other advantage of EMBASE, which I like, is you can actually search for drug. You can search for medical device also. These are actually, so it's like a direct thing compared to Pubmed. Okay, and also the last thing I would like to talk about today is Web of Science. So Web of Science is actually very easy and straightforward. So for one, you don't have anything which is like the mesh terms or M3 or any controlled vocabulary. So it's pretty simple and straightforward. So this is like just the basic search which we do in Web of Science. So I always just say select all. So if you have any specific database you want to select, you can just select, otherwise just say select all. And also by default, so also when we use phrases, double quotations are used for phrases, and truncation in Web of Science is also known as wildcard. So once you enter a particular term, again, I'm just going to use the same example. So then you can take it to advanced, and you again have the option. It could be either all fields, or you can say title or abstract. Okay. So the Boolean operators is also the same. So ultimately what happens is when you are building the query builder is also the same exactly. So once you do all the searches, then you can, it's very easy. You can just, if you have, ideally I would suggest everyone to have EndNote, and you can just automatically download all of that to EndNote. This is for specifically for systematic review. So this concludes my presentation. And I thank you all for your time, and also I am open to any questions. Right.
Thank you so much, Doctor, for this insightful and in detail explanation about how to define the query and how to map the terms. That was great. Thank you, Doctor. And she has also provided a guideline for all of you, for all of research liaisons to work with the document. You are able to work based on an instruction and a written guideline. So we will have access to it as well, in addition to this presentation. Thank you so much. Do you have any question?
I had a question. I'm Ahad Warj. I'm one of the radiology residents. I actually went to Hopkins for medical school. I had a question for Dr. Shilpa. Can you, maybe you went over this, but can you explain exactly what benefit Web of Science or the other one would have over PubMed? I'm used to PubMed. Is there something that those two other services would provide that PubMed doesn't exactly?
Yeah, actually, so the EMBASE covers more databases than PubMed. So PubMed is only looks at Medline, but Web of Science as well as EMBASE will cover more. So when I was doing my systematic review, I looked at so many, when I looked at the articles, especially the ones which are not indexed by Medline or PubMed will not be available through PubMed.
Okay.
Yeah, so it's pretty much like if you're looking at, say, Google Scholar, yeah, when you're looking at it, you can see a lot of articles which are not indexed by PubMed, and we may not want to look at it, you know, sometimes. But if you are doing a systematic review, you want to look at as many articles as possible. So that way, Web of Science and EMBASE is very helpful, especially EMBASE.
Okay, thank you.
I had a question, Dr. Shilpa. If I'm doing a search in EMBASE and then I want to include a lot more articles, like you said, if you're doing systematic review, how do I make sure that there is no overlap between PubMed and EMBASE articles? Like, how do I wean them out? Or I'm not sure how to phrase the question, but.
Right. So what I usually do is there will be some overlap. Actually, in EMBASE, there is a option where you can say that, I think it says PubMed, not Medline. So there is an option where you can pick that, but I don't pick that. So what I would do is, like, I always take all my articles to EndNote, and then EndNote, you can just say remove duplicates and it'll automatically remove all the duplicates. So you don't even have to do anything. But this is again.
What is it called? EndNote?
EndNote, yeah. Okay. Yeah, EndNote is it's just like you have RefWorks, so it's very helpful when you're doing your references, so it'll automatically do it. So for like simpler things, I use RefWorks, which is you know, it'll just, RefWorks is easier just for, like, say, a literature review or something. But then if you are looking at articles in this way, especially for a systematic review, you would want to use EndNote, which is more helpful. Okay. So EndNote also has a free desktop version if anyone wants to try. I think you can only download about like 500 articles in it, but you can also just try to see, try that to see how this works.
Okay, thank you. I have a SciWheel. SciWheel, is that the same thing, kind of like EndNote? SCI wheel.
Right, I think that is an alternative to what is also known as Covidence. Okay. So Covidence is another site which we use for systematic reviews. That is actually for screening of the articles. And I think the one you're mentioning is that one. However, before that, you actually have to download all your articles to a reference manager, which is, in my case, I use EndNote. That's what was suggested to all of us.
Okay, thank you.
I have a question, Doctor. You described how we can use these search strategies and query development for systematic review purposes. Can you guide our liaisons how they can use these methods for their other methodology purposes, you know, for quality improvement, for example, other type of research methods like clinical trials, defined case controls, or case reports, or other type of research?
So actually in PubMed, I don't know if you have seen, but if, like, let's say you're doing a meta-analysis or you're doing a clinical trial. So for those, actually, you don't need to find that many articles, although you may want to go through it just to see if it's been published or not. So actually the method I described would be best even then. But what I usually do is I don't usually look at other databases like EMBASE or Web of Science. Normally, I just look at Pubmed. So the search is pretty much the same. You're using and or not. If you want to make it simpler, it would just be using quotations. That would just be an easier way. And actually in Pubmed, you have options where you can choose, like, let's say only control systematic reviews or I think randomized control trials. So when I'm when I'm looking at topics to do a meta-analysis and I want only RCTs, then I would just choose that option. So that is there.
Thank you so much. But
I'm
please,
sorry,
go
Dr.
ahead.
So yeah, but the way I described about concept 1, concept 2, concept 3, you may not have to do that if you're not doing a systematic review. So that is only, you know, like usually we contact librarians and that's pretty much how they do it. But I think that's not required when you're just searching for articles for other things.
You know, I want to recommend the research liaisons and our collaborators who are working in Larkin Hospital to look at evidence, look at relevant evidence that has similar context and similar population for their quality improvement purposes as well, for defining new solutions, for finding new and advanced care for their patients and families, and their practice improvement. So that's the other way that we can use the search of databases rather than in addition to systematic reviews and review of evidence. We can use the relevant evidence for our quality improvement purposes. How, for example, if you are targeting a solution to better the workflow of patient education, if you are trying to develop a solution for your department to raise awareness of clinical team in terms of one of the things that you know that there is a gap in the knowledge or awareness or education of clinical team. So you should find something relevant from the evidence. And that's the skill set that help you to find relevant, similar situations, conditions, and solutions from the evidence. You can use these known databases to find the best available one to inform the decisions, to inform your quality improvement solutions. You know, when you define a solution in quality improvement project, where you can find different alternatives, how you can be sure that this is the best solution for improving the situation. From evidence. Evidence help you all to define your project topic, to define the comparators, to define everything with quality improvement solutions and the ways that you want to improve the workflow, you want to improve the environment, the exposures, education, timing, and everything. So from evidence, we can find those. These guidelines and this presentation is not only relevant to systematic review or scoping review or other type of evidence review. It's helpful to find alternatives from the medical literature, you know, and best practices. The other thing is best practices. For example, if you want to improve the education strategies in your department, if you want to improve the leadership strategies, if you want to improve the IT technology and appropriate use of technology, EMR, EHR, everything that you have targeted for your quality improvement, the best way is searching the evidence. Find the best practices, the best strategies previous researchers has found previously, and they evaluated, sometimes they evaluated these solutions and they measured the effectiveness and efficiency of those solutions. So that is the beneficial part and advantages of using the evidence, using different databases, because sometimes we search Google, we search Google Scholar, we search Pubmed, but we cannot find something that is similar to our strategy, to our context, to our target population and audience. So you can find it from EMBASE, you can find it from Web of Science. That's the skill set and the art of science, you know, not just for including all resources for your decision, but to select the best available evidence. Thank you so much again. And I invite Dr. Shiruti to explain how we can work on worksheets for this module.
Thank you. So Dr. Marzban and Dr. Shilpa covered a lot of the worksheet, but I just want to do a quick review with everyone, and you all can reach out to me anytime you like to help with the worksheets, or if you have any questions with the worksheet. So let me just share my screen so I can share the worksheet. Okay. Can you all see my screen?
Yes.
Okay. Okay, so like Dr. Marzban went over the first page of this worksheet for module for worksheet 3 is of course to help you with the data search, which Dr. Shilpa went over. The first page is for the PICO's criteria, PICO, and like Dr. Marzban said, that's more for clinical and systematic and evidence review. So I just gave a little example here, population of interest. Like, for example, you can say you identify the patient or the problem that needs to be addressed. Example is obese patients greater than 18 years of age. Intervention is the exposure to be considered, or the treatment or the test. For example, in this case, the intervention would be giving the obese patient low-fat diet. Control is or comparison that Dr. Marzban was talking about. In this case, would be a regular diet or a DASH diet. And then the outcome would be, there could be various outcomes to your research. Would be, one of them would be weight loss or blood pressure reduction and a decrease in LDL levels. So that's the first part. That's how you fill that portion out. And then this part here is a list of research questions. So you can just, brainstorm what the questions you have, or Google the types of questions would be important per your topic. So in this case, it would be, does low-fat diet cause greater reduction in obesity compared to regular diet? Does this diet reduce other diseases such as diabetes?
Dr. Shiruti, do you want them to develop their research question based on their project in this worksheet?
I want them to use their questions to put them here, however many they can come up with.
Great.
Mm-hmm. And so as many questions as you can come up, because that'll help them brainstorm and see what else is out there for their topic. The final criteria, it's mainly to see if the study is worth it. The study is, give me just a second. I'm sorry about that. So the final criteria is to see if the study is worth it. It's to see if, for example, feasibility. You would ask yourself, is your study feasible to conduct in the allotted time frame? So it's a yes or no question. You would put here, yes or no. Interesting. Does your research question interest you? Yes or no. Is this does your project fill in a gap in literature? Is it novel or not? Yes or no. Ethical, can your study be conducted ethically? Yes or no. And then relevance, will your result translate into clinical practice? So that last one is important. If it's relevant, yes, you should go ahead and do further research on that topic. This is the second part of the worksheet, which Dr. Shilpa went over, the query for Pubmed. So you can put your searches here, and the searches or the keywords here with the results and the date. Same thing goes for EMBASE. And if you use Web of Science, you can put your queries here. And then this part, critical appraisal, Dr. Marzban talked about this, how it's important to go through this for your articles to make sure that each of your articles have these titles, have the introduction method results. So you just use this column right here for each abstract or article you go through, you use this column to put the page numbers down to see if that article is complete article or not. So this one, consort, you use it for the randomized controlled trials. And then the next one is Prisma, which you would use for systematic reviews. Same goes for this. You would just use the, look at the article and go through the page numbers to make sure that article is complete and it's a good article to review. I think that's about it for this article. I think Dr. Marzban, this bottom part of the article, are they completing this part as well? Because I don't know if we went over it or not. Number 6.
Okay, let me summarize the steps here. The first step is defining your research question. Okay, defining your research question with the PICO criteria. If it is a quality improvement, you should have another pattern for defining your research question. So you can have another research questions. Let us know. So right now we cannot bring another pattern for you. For systematic reviews, review of evidence, for clinical trials, and the case control one, this is a good pattern to mimic this pattern with a PICO. For quality improvement, it's something else. So we should work with you during the Zoom, on the Zoom meetings, or one by one. We can work with you and provide some consultation about that. The other thing is, again, think about your research question. Is it something interesting for the other people, for your patients, families, and customers? Is it something interesting for your peer colleagues, professional people, clinical teams? Is it novel or a repeated research project, something that has been done recently? For example, another research group has been done, have worked on a similar systematic review. So why you want to repeat it again? It's not a novel approach, but if you target something at Larkin context, it would be novel. So the context is important. And the ethical situation. For us, the main and important part of this worksheet is having your research question. So please focus on that, the first part, the part A of this worksheet. And after that, please work with the skills that Dr. Shilpa explained now and shared her experience with you, how to search and how to define a query on Pubmed. If you define your query, develop your query in Pubmed, that would be meaningful for us. Please work in this part of the worksheet as well. So the first question and the second one, the Pubmed. Focus on this. If you are more interested, you can develop the other databases as well. So this is to facilitate your work, What are these ones? These ones are quality control of the evidence that you find. Remember that we shared with you different parts of a review of evidence. First of all, collect the evidence. Second of all, appraise the evidence and then assemble it. For appraising the evidence, you need these checklists to work on it. So for RCTs, you can work with this. Can you please? Okay. For critical appraisal of systematic reviews, to do an umbrella review of the evidence, you need this one. So there are many tools that you can check the quality of the evidence that you collected from databases. These are not a part of worksheet, just for your more and further information. we have put this. And the latest part of that, the last part is systematic thinking. Is it only the clinical factors that affect your main condition or your main issue, or you think that there are personal, family relevant, social, and global things that affect it? And can you explain the stakeholders of the research issue? This part, question 6, works for the people who are developing an idea for quality improvement. For quality improvement ideas, we need to know who are stakeholders. We need to know what are surrounding factors, what are social factors, personal factors, family factors, organizational factors. And the other one is what are system level factors like policies, procedures. If you want to improve the education strategies, if you want to improve the leadership strategies in your department, or data recording and documentation strategies like EHR, you should bring some policy procedures and the issues with managerial and leadership context of your department. So that's why we want your systematic solutions and systematic recognition. And what's your primary assumption if you want to prove the causality or correlation between those variables? This is not the thing that we expect you for this time. Just focus on A, B, C, D if you have quality improvement, and provide your research question, please. That's the core aim of this workshop. Thank you so much for everyone that has joined today. We had 1 hour and 30 minutes time for this meeting, and we were very happy to assist you. Again, I appreciate Dr. Shilpa for joining today, and we wish that invite her again for the future meetings to use her experience. Thank you so much and have a very nice evening. Bye-bye.
Thank you.
Thank you so much. Good night.
Let us know if you have any comments and